Thank you, sir. Good morning, everyone. I'm Dr. Parasa, and let me thanks Dr. Bansi Sabu and entire for. And today I'm going to talk approach to a person of sexual. My topics are divided in four sessions. Introductions, male sexual. Try to cover up every aspect on, but little faster. First aspect was the introduction. Will someone please tell me the solution to the food crisis in the rest of the world? This was the questions once asked by the Secretary General UN. And you will get amazed what reply the different delegates had given. Ethiopian delegate asked, what is the meaning of food? European delegate asked, what is the meaning of crisis? Middle East delegates asked, what is the meaning of solution? American delegate asked, what is the meaning of the rest of the world? And our own Indian delegate asked, what is the meaning of please? What I mean to say, when it's come to the sex, if you ask the opinion of different people, people also have the different opinion about the sex. To the public, sex means naked man and woman coupling. To the physician, sex is a cause of AIDS. The moralist, sex is a taboo. The anatomist, sex means only two alternative, male and female. And most basic level, sex is genetic recombination. Masters and Johnson had given four basic parameters for the sexual response cycle. First is the excitement phase, play to phase, orgasm, and resolution phase. In this slide, I'll try to set different. What is the difference between male and female sexual response cycle? You see in the male cycle, orgasm, tip of the orgasm is very short, and resolution is very fast. Whereas in the female, if you see the orgasm, base is little bit broader, and they can reach the resolution with or without the orgasm. What is sexual dysfunction? Sexual dysfunction is broadly defined as inability to fully enjoy sexual intercourse. Sexual dysfunctions are disorders that interfere with the full sexual response cycle. This disorder make it difficult for a person to enjoy or to have sexual intercourse. Now come to the section 2, that's the male sexual dysfunctions. There are three most common sexual dysfunction. One is the lack of desire, second is erectile dysfunction, and third main part is the premature ejaculations. Male sexuality is a complex physiological process, the important part of quality of life. I'll ask you one simple question. If I want to lift my this finger, how can I lift my finger? For that I should have intact bone, blood supply, nerve supply, muscle should be intact, everything are intact, then only I can lift my finger. But when it's come to the erections, what we think? We need only one naughty thoughts, and then only we can get erections. But that's not true. For getting proper erections, involving the coordination of nervous systems, the cardiovascular systems, endocrine systems, and reproduction systems are must. Then only one can get proper erections. It's not only naughty thoughts. In 90s, there says sex lies between two ears, not between two legs. But nowadays, when the new things are coming up, new drugs are coming up, new investigations are coming up, it's more organic than the social causes or psychological causes. There are certain factors which determine sexual dysfunction. Some disease like diabetes, cardiovascular disease, cancer, lifestyle disorders like obesity, smoking, which can lead to the atherosclerosis, alcohol, some good drugs which have the good effect on the body, but they have the bad effect on the sexual life, like antidepressant, cardiovascular drug, particularly beta blocker, can lead to the erectile dysfunctions. Now come to the part section number 3, that's the erectile dysfunctions. Here are some facts about the erectile dysfunctions. Endothelial dysfunction appear to be the final common pathway for many cases of erectile dysfunction. 2/3 of men with hypertension have some degree of erectile dysfunction. 60% of men presented to a sexologist clinic had undergoes lipid abnormalities. More than half men with erectile dysfunctions who have no cardiac symptoms have abnormal stress tests, and 40% have been found to have significant coronary artery disease when studied. When men is hospitalized for their first myocardial infarct, 64% had erectile dysfunction with the onset 3 years and more before the interaction. Fractions. What I mean to say here, whenever patients approach with you with erectile dysfunction, please never directly give the sildenafil or tadalafil or anything else. You might uh, lose the main diagnosis of cardiac events or something like that. ED does not mean only erectile dysfunction. ED means endothelial dysfunction also. So you should first properly evaluate, then only should prescribe any medications for erectile dysfunction. Mainly erectile dysfunction are because of the two reasons: psychological and organic disorders. How we can differentiate persons having the having the psychogenic erectile dysfunction or organic erectile dysfunction? By history taking only. When in psychogenic, patients usually give the history. Doc, I get to use proper erections. I do indulge in the sexual activity 1 month back, but since last 15 days, I am not getting proper erection. I am not able to have sex since last 15 days. 2 months back, I was used to do it, keep it relations twice a week, thrice a week, but suddenly this had happened. And organic, he will come and say, give the history, doc, last 2 years, 3 years, I am not getting proper erection, or my erection is slowly getting down. In psychogenic, it's always specific situations, and organic, all the situations, whether it's a night, morning, home, outside, where he will not get proper erections. In psychogenic, he'll say, doc, I get normal, I get proper erection in the night, and I do get morning erection also. But whenever I try to perform, I loses my erections, or I don't get my erections. Where in organic, all the times, whether it's the morning erections or in the nocturnal erections, he may not get proper erection, or erection is not that strong. Possible relation problem, wife, you having the fight with the wife or girlfriend, for particular time or particular period, he may not get erection. But when he's organic, he say, doc, I love my wife, I love my spouse very much, but still I do not have the proper erection. She is very supportive, still I am not able to get proper erection. So by taking history, detailed history, you can even diagnose whether the person is having psychogenic erectile dysfunctions or organic erectile dysfunction. What are the causes for psychogenic erectile dysfunctions? First and foremost is the performance anxiety. I always give example of Sachin Tendulkar to all my patients. तेंदुलकर ने एक मैच में सेंचुरी बनाई, दूसरे में सेंचुरी बनाई, लेकिन तीसरे मैच में जीरो में आउट हुआ, चौथे में जीरो में आउट हुआ, पांचवें में जीरो में आउट हुआ. दैट डजंट मीन ही विल नॉट एबल टू मेक वन मोर सेंचुरी ऑन द 6th गेम. सेम वे, कभी कभार आपको इरेक्शन नहीं आता है, सिचुएशनल हो, कोई परफॉर्म थक गए हो, कुछ भी वजह से हो, तो यू मे नॉट गेट प्रॉपर इरेक्शन दैट टाइम. दैट डजंट मीन योर सेक्स लाइफ इज ओवर. Second is relationship problem. Whenever you have fight with your partner in the morning or in the evening, and you want to perform in the night, you may not able to do it because back of the mind that fight is still going on in your bed, in your mind, so you will not perform. Problem with intimacy, depression, guilt feel, previous sexual abuse. Many of time your partners had abused you about you are not able to perform, you are not able to satisfy me, and because of these words, he may not able to perform, or hearing the performance anxiety, whether I'll able to satisfy my partner or not, whether she will satisfy or not, if I'll not able to satisfy her, what she will think about me, and all these can lead to the performance anxiety, and that lead to the psychogenic erectile dysfunction. Are the certain risk factors for the erectile dysfunctions. Mainly is the diabetes, heart disease, hypertension, stress, anxiety, and age. As the age progress, your having the ability to get proper erections also decrease. I always say there are 4S in the human lives. If this either any of 4S, if you have these 4S, you will not enjoy fifth big S of sex. What are these 4S? First is smoking, any form of tobacco, whether it's chewing tobacco, whether it's a smoking, or gutka, any form of tobacco. Second is scotch, whether it's a 5 rupees alcohol or 5,000 rupees alcohol, whether it's whiskey, rum, beer, anything. Third is S is stress, and fourth is sugar, that's a diabetes. These four S, if you have, you will not enjoy. Fifth uh, S, that's the sex. Two things is in our hand, two things are not our in hand. Smoking and scotch is in our hand, stress and sugar is not our hand. At least जो चीज़ अपने हाथ में उसको तो अवॉइड कर सकते हैं हम. So try to avoid smoking and scotch. After taking detailed history, we need to find out, we need supportive evidence, so we need some lab investigations. These are the basic lab investigation whenever the persons appear for with sexual dysfunction. First is, foremost is HbA1c. You should get it done if is 30 and 30 plus. Even nowadays we see the in younger people also, so you should get it done. That also, lipid profile, hormonal profile, particularly testosterone, free testosterone and prolactin. Prolactin should be always a pool sample, you should take it. Other like thyroid, and if patient is above 45, PSA is must. This was that was the about blood investigations and lab investigations. What are the vascular evaluation you should do? First line of vascular evaluation is intracavernosal injections. This will allow bypass the neurological hormonal influence and directly evaluate the penile blood flow. Usually we use papaverine or bimix for these things. Second is color Doppler of the penile. By this we can able to find out whether the person is having the arterial problems or the venous leakage. After diagnosis, it's a time to give the treatment part. So what are the treatment modality we can offer them? First line of treatment nowadays is PDE5 inhibitors. If venous leakage is there, then vacuum devices, then intracavernosal injections, that's papaverine or bimix, or penile. If and everything fails, then penile prosthesis. This phosphodiester 5 inhibitors, that's a PDE5 inhibitor, which consists sildenafil, vardenafil, tadalafil, and avenafil. Sildenafil was the first line of drug which was available for these. That was the first. In this group, avenafil is the newest one. Certain things, whenever we prescribe these PDE5 inhibitors, we should know about these things. First thing, if his patient is in nitrate, in any form of nitrate, we should not give these PDE5 inhibitors. Second thing, we have to educate the patients. Many of time patients come and say, doc, I take a 50 milligram, I've taken 100 milligrams. I'm taking since last 15 days. Every day I'm taking, but I'm not getting erections. Why is not getting erection? Probably when you take the detailed history, he'll say, doc, I take medicines there, I stay with my partner. He doesn't touch me, I doesn't touch her, and we just lie down over there. No. These sildenafil or PDE5 inhibitors, they will enhance your erection, but for that person have to put some effort. He has to do some foreplay. Then only this medicine is going to work. Many of time patients don't, because we have not tell them. So they say, they think automatically they will get proper erections. So we have to educate whenever we prescribe these medicines. We have to educate how this medicine is going to work. If it's taken empty stomach, it will work fast. With fatty food, it will work little. It will take longer time to act. Second line of treatment is intracavernosal injections. Usually we'll give the papaverine, or papaverine is not working, then we'll give the bimix. That's the papaverine and chlorpromine mixture we make in the clinic and give it to the patients. This was very popular before the PDE5 inhibitors came in the market. Nowadays hardly we use this, because most of the people, they will get proper results with the PDE5 inhibitors. If that's a testosterone level is low, then we should prescribe hormone replacement therapy. Now come to the section number 4, last section, premature ejaculations. How to evaluate premature ejaculations? First thing, diagnosis is based largely on the patient's self-reporting intravaginal ejaculatory limited time. Important questions to discuss with the patient. We need to ask some certain questions to the patients. What is the time between the penetration and ejaculation? Can you delay the ejaculation? Many of time patients, they have the misconception that I have we have, because their friend says you need to perform for half an hour. He perform for 10 minutes, so he consider himself as a having suffering from the premature ejaculation. In fact, he is not suffering from premature ejaculation because his friend, what they said half an hour, that time start from when they start enter in the room and they leave the room. From that time they are telling, not the actual penetrating time. So we need to ask certain these all questions we need to ask. And many of time patients come and say, doc, last moment if I want to hold it, but I cannot hold it. So can you delay the ejaculation? Can you hold your ejaculation? Do you feel bothered, annoyed, or frustrated because of your this ejaculation timing? Have you experienced this problem since your first sexual experience or every attempt with the every partner? Uh, there are two types of premature ejaculations: lifelong premature ejaculation and acquired premature ejaculation. Acquired premature ejaculation usually is a sexual performance anxiety. Someone will be might come or they are in the hotel or not safe environment or with the outside marriage partner, so they have the fear someone will come and knock. So because of that fear or anxiety, they ejaculate fast. Psychological relations concerns, erectile dysfunctions, prostatitis, and so many other things are there. How common is premature ejaculations? Forget about these all numbers. I always say premature ejaculations is as it's more common than the common cold. So now, how premature ejaculation is defined? Over the last 40 years, numerous definitions have been proposed and used. In 2013, the International Society for Sexual Medicines defined premature ejaculation as a sexual dysfunction characterized by ejaculation that always or nearly always occur before within the approximately 1 minute of vaginal penetrations. That's considered as a lifelong premature ejaculation, or person says is not always and is able to ejaculate 3 minutes or around 3 minutes, then it's the acquired premature ejaculation. Inability to delay ejaculation on all or nearly all vaginal penetrations. How can one can improve in the premature ejaculation? Physical fitness is must. I always say, just 2 minutes. Okay. Give me just. I always say, जिनके पाँव चलते हैं ना, उनका पेनिस भी चलता है. So because whenever you walk, because of how man gets proper erections, because of blood flow. So when you walk, your blood flow increase in the pelvic region, so it will increase your erection part. I think Dr. Manoj Bhai will start walking from tomorrow. He's laughing. So, but anyway, it's good for heart also, Manoj Bhai. Behavior therapy is like a start and stop techniques, which technique I don't go in details, time doesn't permit. Topical agents are like lignocaine and all, but I usually don't prefer lignocaine because it increase the time, same time it will take away the pleasure. तो ऐसा लगता है लिग्नोकेन लगाने के जो यूज करता है उनको ऐसा लगता है कि उनका ड्यूरेशन तो बढ़ गया है लेकिन वो मजदूरी कर रहे हैं, प्लेजर नहीं रहे. वी डू सेक्स फॉर टू रीजंस, वन इज फॉर फैमिली एंड सेकंड इज फॉर प्लेजर. इफ प्लेजर इज नॉट देयर देन व्हाट्स द यूज ऑफ डूइंग प्रोलॉन्गिंग द टाइम. And second thing, if they don't use the barrier method, that's a condom, then the effect will be on the partner also. So partner will also not feel pleasure of. So lignocaine is not. Best is SSRI and tricyclic antidepressant. Either you can give it on the daily doses or you can give it to the on demand. But this can also lead to erectile dysfunctions. So whenever we prescribe, we should be careful about this thing. Tramadol. Tramadol, it's a newer drug is not approved by the FDA, but still it is used for the premature ejaculation, and in many patients, patients come and say, "Doc, it's a very useful for us." Alternative therapies are pelvic floor therapy, acupuncture, yoga. Yoga is Aswini Mudra and Vajroli Mudra. Through mudras are there. They are giving very good results, but only thing it takes time. Circumcision again as a contra. People have the different opinion about the circumcision. Botox is the newer things, and dorsal penile nerve surgery. Many things to still it's in newer things. So we need to learn many things about all these things. Premature ejaculation has very specific definition. P is common but under-recognized. I has already told you it's more common than the common cold. Diagnosis involved through the discussion of sexual and medical history. There is a wide variety of treatments available, and always your family physician or sexologist will able to help you out about these problems. Before just I'll take one more minute before going to the end my topic. Whenever you persons come with the sexual dysfunctions, yeah, we should find out the myth and misconceptions. These are the list of myth and misconceptions people have, because many of times they actually not suffering from the problem, but they have the misconception about these things, and because of that they think they are suffering from this problem. So I always before ending my consultation, I always ask two questions to my patients. ऐसी कोई चीज़ है जो मैं पूछना भूल गया और आप बताना चाहते हैं, और पेशेंट विल कम विथ ऐसा आंसर देगा कि आपने डायग्नोस में मिस कर दिया होगा, कुछ मिस कर दिया होगा, तो वो चीज़ आपके लिए बहुत इंपॉर्टेंट होगी. और सेकंड थिंग मैं उसको ऑलवेज आई लास्ट हिम कि आपको क्या लगता है आपकी ये प्रॉब्लम उसकी वजह क्या है. सो मैनी ऑफ टाइम्स से डॉक मैंने बचपन में मास्टरब्यूशन बहुत किया था ना, उसकी वजह से ये तकलीफ आ रही है. So there are so many things are there, like so you should ask these all two things. And thanks Dr. Bansi Sabu and entire team for giving me this opportunity. Thank you very much.